Hello, good morning, good afternoon, good evening, everybody. Welcome to USMLE 301. And this is the third and the last series for the people who are applying for the United States medical licensing exam. And my name is James Koola, and I'm here with my co-host, Professor Frank Minja. Welcome, Frank. Introduce yourself while I try to bring my slides up.
Yeah, asante sana James for the opportunity, and asante all for joining in on this session. This is for those who've at least completed at least one of the step exams, so it's going to be a little bit more advanced. For those who are joining for the first time, there are other series, USMLE 101 and USMLE 201, which give a little bit more of the basic steps towards trying to gain residency. So this should be for people who are almost ready to start application. And again, James is going to take you through the review of the steps and take moderation for the rest of the session. Asante sana, James, and all the best.
Okay, guys. Again, welcome to USMLE 301. And my name is James Ignas Koola. I'm the Associate Program Director for the IMPM program in Debbie, Connecticut. For some reason, I cannot see my picture, but I assume you are seeing me all. So this is one of the three series that we have, and in which in the first one, we are kind of giving an overview of USMLE. And then in the second one, we are talking about, preparing for the exam. And then in this third one, we are talking about application. So as an associate program director, one of my core functions is to review application and interview applicants. So I think I'm in a prime position to kind of be able to kind of digest and share with you kind of the inside scoop of what you need to do to bring in a very strong application. And as I said, we have three steps. And of course, in step one, that is for everybody. It's an open, everybody can come in and join, even if walking from a street. And for 201, there are only those people who have USMLE number and they are ready to start preparing. And there we are teaching them about the preparation, of course. And I said the 301 is when we kind of talk to people who are almost applying. And just looking through, the whole process can be overwhelming. And there's a lot of psychology, to the whole USMLE process. So you want to be fit and ready to kind of bring your A game and give yourself the best chance to match and continue with your training. So I have a panel with me. I've brought in a couple of people to kind of help me fill in the blanks and share their own experience, So I have with me a recently matched, match this year, Moza Abed Hamoud, who is originally from Kenya, born and raised in Mombasa, Kenya. She did her training at St. George's University in the Caribbean Islands. And Moza has matched into internal medicine in California. So July 1st, she's going to be a brand new intern, starting her medical journey. And she's aspiring to do hematology oncology. And so welcome, Moza, and thank you for being with us. We know it's the early morning in California. We appreciate, your dedication through 101, 201, and now 301 and supporting our applicants. And then I have also with me Hesbon Magacha, who is PGY1. So come July 1st, Hesbon is going to be PGY2. He's going to be a resident and he's going to take care of interns. So he applied not more than a year ago. And husband is originally from Tanzania, but did his medical training in Cuba. Is doing his internal medicine residence at East Tennessee University. And with me in the panel, I also have Dr. Winnie Temu, originally from Tanzania, born and raised, graduate of Muhimbili. Winnie has an interesting story. She's PGY3, and so she's graduating. She has signed her contract. She's going to be a full-fledged attending come July 1st. It's all part of the training cycle, you have to understand. And Winnie, when she matched initially into a prelim position. So she applied and she ended up matching into a prelim position. So she called me like she's freaking out. You know, I didn't get a categorical 3 years. I just have a 1 year slot. And then like, Winnie, relax, enjoy, have a sip of wine. Your leg is in. And she finished her prelim year and smoothly transitioned to PGY2. So, you know, so it's all those people have different routes. And one of the things we want to share with you is the experience and the things and to think as you go through. And then we have also with us Barbara Odak, who is a PGY2, originally from Nairobi, Kenya. Barbara is my resident. She's PGY2 IMPM, Internal Medicine, Preventive Medicine in Griffin Hospital. Barbara is joining us from Nairobi. She's currently on vacation. She's in Nairobi, but she said, I'm going to join in. I want, you know, to share the perspective. I want to be there to support my people from Jamhuri. So Kenyans, you are represented highly here, and we appreciate that. So also with me, I have Edward Mtui. Is an assistant professor of radiology at Columbia University. Edward is originally from Tanzania. He did his medical education at KCM College in Moshi. Edward and me, we are studying USMLE at the same time. So we applied and we matched together in our intern year. And then he did radiology and then went into neuroradiology. Welcome, Edward. We'll be tapping into you. If there are any radiology aspirants, I mean, we have radiologists in the house, and you know, we are here to support you and to make sure that you continue succeeding. So what is at stake? You know, it's the application process. You know, we're going to tell you what is at stake. And then we talk about the error system. And then I'll talk about clinical experience, because it's mentioned a lot in the application. Clinical experience, personal statement and reference letters. What do you need? Program choices. You know, the way you choose your program can determine if you succeed or you do not succeed. And of course, interview process and post-interview and follow-up and kind of, you know, feed in with real life examples of what you need to get done and do it well. And so as you are in this place, because I mean, you have done at least step 1 of your exam. So congratulations for taking your exam. I mean, you have walked the walk, and here you are. And of course, this was by invitation only. And we invited people who, you know, have at least done step 1. So the application process is really cumbersome, and you need to do it early and do it early. If you make a mistake, it means losing a year of your life, which means you don't match 2025, you end up matching 2026 or 2027. So you don't want to make a mistake, because, you know, a mistake is costful. And so it's very important, you know, that you do things timely, you do them right, you don't really, you know, take unnecessary risk, and you ensure, I mean, we show you the ropes that you touch the right buttons to ensure that you do it well. So you need to put a very strong application forward, you know. It's and you'll do this by kind of preparing it well in advance and looking, you know, at all things you have. You need, and this is important for you to maximize your chances of matching. And of course, you have to, now you have, I mean, it's hard to study. So you have put in all the work, you have passed your exam, and you know, you have to approach the application process with the same energy that you approached and killed your bots. So this is not time to be complacent. It's not time to take, you know, a back bench approach. You have to be very proactive and with intentions, and make sure that, you know, you put your best foot forward and you put as strong application as you can. And so you need to familiarize. So the electronic residency application system is where the residency application goes to. And I'm sure at this juncture, you know, you have heard about ERAS, you know about ERAS. So make sure you familiarize yourself with ERAS. When ERAS opens, immediately take your token, go in, start exploring the system. Even if you are not ECFMG certified and you are thinking that you'll be applying in September, when the token opens, take your token. And also you'll be putting pressure on yourself. That's step 2 you are trying to push forward. You know, now I have a token I've paid for, you know, I need to be able in a place to go for this. So rely on previous applicants to pick programs, you know. So if programs have filters, I'll tell you, and money is scarce, don't waste your money, because when before you put in an application, you research about the programs. You see, do they take international medical graduates? Are there people like you in that program? Or the last IMG they took is 1970s. You know, what do they say in their broad scheme of things? There's program you'll find in the instruction, not more than 3 years post-graduation. We cannot, in the US, by labor laws, we cannot, even if you are 61 years old, you finished last year, or you are finishing this year, I'm going to consider you the same as somebody who is 25 years old. So we don't use your age as a criteria. What we use is time from graduation, which is not age and is not considered discrimination of age. And so you'll see a program saying they only want residents not more than 3 years post-graduation, and you are putting your application in there while you know you graduated 7 years ago. They are not going to call you. You know why? Because in the ERAS, when you are reviewing the applicant, we have filters. So you can put filters and say, you know, I want medical year of graduation 3 or less. And everybody who is more than 3 years will not even show up on my review screen. So you will not even be seen. So by you applying to those programs, you're wasting your money. The $26 I think you pay per program you apply to, that money is wasted. So it's good for you to do research in such a way that you don't waste the valuable resource that is money. In ERAS, they need a picture. Don't take a picture with your phone and put it in there. You know, this is a time. Go and do a nice professional portrait. We look at those pictures, you know, as you are I mean, these days interview is Zoom, so there's so much we depend on what you put in. So presentation is everything. Present yourself well, you know, don't do a disservice to yourself. So clinical experience, this conundrum of clinical experience. We as programs, we want to make sure that you are positioned to succeed. You know what you're applying for. You know the worst nightmare for program director and the associate program director is recruiting somebody in July, and then in August is like, oh, internal medicine is not for me, I'm out. They can walk, but what is at stake is that slot is left open. The schedule has to be reshuffled all over. We as humans, we don't like changes. And so it's like somebody who was supposed to go on vacation has to cover that person in patient rotation. So everybody becomes miserable. So we want somebody we take, knows what they are coming to. So when you have done like rotations, you have done research, you have shown that this is something I like. I know about internal medicine. I know about radiology. I've done 3 publications. I've worked with so-and-so radiologists. We know you know what you are coming to. Although you don't know all of it, you'll see more of it when you really enter the game in July, but at least you have, you know, a glimpse. You're not a deer on the headlight. And so it's those parts which are not said, which kind of the clinical experience contribute to. It helps sell your commitment to the specialty. I mean, you have done all your rotations, all your electives, all your publication in pathology, and then you're putting with your CV leaning pathology, you're applying for internal medicine. I'm like, what's going on? What's wrong here? You know, you cannot, they are not connecting, and that will kind of raise questions. So when you rotate with somebody, when you do the clinical experience, that person can vouch for you, your interest, your attitude, your work ethics, your potential for career success. And those are the things, you know, that will come, and we are looking for to kind of see how you can make a good candidate. You know, it's hard to get a detailed reference letter if somebody has no work relationship with you. And we really look at those letters. So observership is a time to sell yourself. When you are doing an observership somewhere, consider yourself, you are under a microscope, and everything you are doing is a tryout for the real show. So put your best foot forward. You know, I will see somebody come in doing observership, and then probably their step 2 is closer. And after rounds, the next thing they do, they go sit in the corner and they start studying. That's a bad use of your time. That when you go and do observership somewhere, give it 110%. Be there, be present, ask intelligent questions, contribute. Let them see that you can fit within their team. That's what you're trying to do. Show them that. That's what they are. So we are constantly looking, will this person be a good fit? That's a question we ask ourselves every day. Sometimes we answer it wrongly, but guess what? I mean, if you see things related to, most likely will work. You know, as you enter the activities. So when you come to errors, you enter different things. You enter them in such a way that they might seem like haphazard, but at the end of the day, they populate and become your CV. So pay very close attention to how you write your activities, you write your things, make sure you review things, make sure you have no typos, you know, your personal statement, you know, take time to write it, ensure you write it well, get someone to look at it. You know, we are not, most of us here, we are not, English is not our first language. Even if you learn it from grade 1, everybody around you was not speaking English. So English is not your first language. So there's something you might write and you think you are totally right. Somebody whose English is first language, you go, this does not make sense. You know, so write it to your own and kind of bring it up. Think early. How do you want to present yourself? What story do you want to take? What you want to take? It's a 1-page document, you know, hardly 1 page and extra 1 paragraph. We read every word, I tell you. We read everything, you know? So it's time to explain your passion for the specialty, what you like and everything. But one thing which I find, and I think sometimes we do a disservice to ourselves, is not a place to complain how life has been disadvantaged to you. Don't explain to us how you have suffered. You're not interested. Tell us what's your love for medicine. Why did you go above and beyond to do medicine and all those things, and why you are going for that specialty? Try to make it in such a way that it's catchy enough for somebody to remember you. I can't tell you how many books I've bought and read and found so interesting because I found them quoted in people's personal statement. You know, so, and that person, I remember them, you know, like this person who made a quote, you know, of this, there was this quote of, when you really want something, the world conspires such that you get it. There's a book, I think it's called Alchemist, a book by Alchemist, and I bought it and I read the book, and it's very interesting. So try to, and the way you write these good personal statements is taking time, writing, thinking about it, sleeping on it, and kind of, if you write and you are rushing, we'll see. I mean, this is haphazard. There's no real commitment here, and it does not reflect anything. It doesn't sell you. I read it and I forget you right away. ERAS allows personalized personal statement. I mean, personal statements, which is why, among other things, you tell you why you like the program. And so when you give time, you can try when I applied for almost all the programs I applied to, I mentioned them in the personal statement, which means I wrote personal statement for each program I applied to. So it might be like, oh, you're applying to 120 programs and then you cannot do, but your top programs, consider mentioning things that are related to them, consider mentioning them. I like it when I read somebody's personal statement and is mentioning my program. I remember you, like you have done your things and you are interested. It's not just you picked and checked boxes and submitted, because it's very easy to do that. Example for me, when I do internal medicine, preventive medicine, frankly speaking, if you have nothing preventive medicine related, I don't care. I don't think you will thrive. I don't think you're mentioning it. I think you are just applying to internal medicine and you found this internal medicine, preventive medicine, and you think it's just one of them. It's not. I want to see, your demonstrated interest. I want to see like there are things, they'll show me that you'll come, you'll thrive, you'll be enthusiastic, it's hard work and you're going to do it, So, it might be a lot of work, but as I said, if you start, doing it early, it makes sense. And the thing you will shoot yourself is to write a personal statement saying you're interested in internal medicine, and then you submit it to pediatrics. It's just like, sending a letter to a wrong person. It's like, why? I mean, this person, it shows that you don't even pay attention to detail. You are missing this. So how will you catch up a hidden diagnosis if you cannot, catch up even like those simple typos that don't relate? Your reference letters, you need a minimum of 3 letters. Do not submit without the minimum numbers. Program will screen. If not 3 letters, they will not even look at you. So even if you do not have American, get your local, get from your professor, ensure you have 3 reference letters for every program you apply to. And as I said, to get a strong letter, you need to work with that person. So don't go to a person cavalier, somebody is texting me, write me a reference letter. Like, really? I don't know you. What am I going to put in there? It's going to be, rather than get a mediocre reference letter from somebody who you don't have working experience with, you better get a strong reference letter from somebody, who is not that known. Always when you ask for reference letters, waive your right to view them, because then it will show us, oh, they waived their right to see them. So it's really authentic. He didn't write under the threat that this person is seeing what I'm writing. Of course, we prefer, most programs prefer letters from American trained physicians. So wherever you are, as you are in your application process, if you have an American physician visiting anywhere in the world and you work with them, they give you a letter, is as good. Let's say Professor Minja is coming to Muhimbili, you work with him there, you do a presentation, you present cases to him, you read images, and then you apply, like Professor Minja write a letter to me. Although you have not been to the US, the letter he writes is as strong as somebody you have been with in Stanford. So take advantage of that. Be kind of, do intentionally. Have an intention of doing that. Do not approach people for reference who you don't have strong relationship with. Like you have working relationship, they can put, because the last thing you want is a weak letter. I cannot overemphasize that. Make sure you tell your letter writer the specialty you're applying to. Do not submit a surgery letter for IM, a PIDS letter for internal medicine, or a radiology letter for pathology, Make sure you don't mix up. Usichanganye madawa, don't mix up. If you're applying for multiple specialties, you should have letters labeled. It's understandable. We are international medical graduates. Sometimes somebody will apply family medicine, PIDS, and internal medicine. Make sure you have separate letters for all those specialties. You have to make sure. So you can decide to tell like your letter writer, like, I've not decided, so please don't specify a program in the letter, and they will write it generic, and that's how it will come, and then you can use it across multiple specialty. But don't use a surgeon letter for internal medicine, So there are other specialties which are far away, but if you are using my internal medicine letter, you're applying for family medicine, it's within the same vicinity, and it's more acceptable than not. So with visual interviews, people, you know, before when we are interviewing, we used to fly and travel. So people used to limit where they'll go to because it's cost thing. Nobody will go to 25 programs. Mostly they'll do 8, 10, then they stop there. But now with virtual, you're just sitting in your bench and you can kind of communicate. People are applying to more programs. It does not cost them a thing apart from the application fees. So now we will hear from the recent applicants. You need to apply for more programs to kind of give yourself a chance. You know, the most first-hand application from the recent applicants, where did they apply to? And I'll advise everybody, go to this FREIDA website. It's owned by American Medical Association. Actually, you can join as an associate member, as a medical graduate without paying fees. So join for that free membership and then go to FREIDA. In FREIDA, they list all the residents in the US. So, and they give the demographics, what percentage is IMG, what's the one, and what are the faculty, and what are they. And so you can look through and kind of try to narrow down. Make sure you have a spreadsheet where you research and put your list. But most importantly, the people who have applied recently, where did they interview? Ask them. Consider those programs. Look at them and consider them in your application. So you're more likely to match if people like you have matched, and so you take advantage of that. It's a game of numbers. And when you are choosing your specialty, be true to yourself. Look at the scores. You know, I was chatting with somebody like 2 weeks ago. This person is really interested in neurosurgery. But then he failed his step 1, he's trying to do a second attempt. And I'm like, dude, you're not gonna go there. You see, you look at, I mean, those are like neurological surgery. You see what percent. I mean, these are highly coveted and kind of specialties. And because a lot of people want them, then they end up recruiting people who have real high scores. You know, you see like plastic surgery, people who match there have above 250, 255. And people who don't match has like 245. So somebody has 225 when he's applying for plastic surgery. What do you expect? You're not going to match. So make sure you look at these kind of statistics and realistically tell yourself what you're going to do, you know, and so kind of see where you fall and, you know, give yourself, be true to yourself. So one of the things we noted consistently is the surgical specialties are very hard for international medical graduates, even for US who trained outside. And you can see from this chart, for this year, the percentages, you know, of people like thoracic surgery, there's no IMG, either US or non-US, who matched there. So like, oh, I want thoracic surgery. Yeah, you want thoracic surgery. Okay, go and do it in Muhimbili or do it in South Africa or in Nairobi, but you're not going to do it in the US. You know, they have 48 positions only in the whole country out of more than 30,000 people who matched. So it's not that if you have 215, you won't be able to do thoracic surgery. You might be able to do and pass it real well, but you're not going to get a chance to go there because people who are more overqualified than you want it. So these are the people who they have done research, they have done thousands of publications, they are strong, they are standing out, they are selling their case, and they are going in. So be true to yourself as you are kind of narrowing down your list. Make sure that, you know, unless there is a genuine reason, you submit your application as soon as ERAS opens for submission in September. And even if you are delaying, make sure that you know when if you Google, you will see the date when deans in the United States release what they call the dean's letters. Now it's called Medical Students Performance Evaluation. They release it, I think, towards the 3rd week of September. Make sure you submit your application before that, because when the deans release their MSPEs, that's when program starts looking at the applications. And so, and when we start, it means like if your application is not in, So probably you will not be in the list that I'm looking at because, you know, and then if I don't look you at that time, and then probably I want to look at you forever. So it's very important that you are there timely so that your application is downloaded with the the total group, and then you have a chance to be reviewed. And so program receive a lot of applications, and we have limited slots for interview because we have really limited time. I'll give you an example for my program. We get 5,000 applications. We can only interview 200 people because we have, like, I think probably 10 interview days where we interview, like, I think we have like 10, 14 interview days, and we can only interview 200 people. And then out of these 200, we have 20 slots to fill. And so, you know, so it's 5,220. And so it's, you know, it's competitive, but it can be done. But I want you to appreciate the magnitude and what happens, you know, and the importance of you putting your application timely, because if I've downloaded them, really, I don't need to go back and look again. So nobody probably will look at your application that you put in on October 5th. So trying to stay on time, to have your application in on time, I cannot overemphasize that. Prepare for interview well. Now, when you have put in your application, now you're called for interview. You need to prepare. Either you are seasoned or you are a rookie, you have to prepare. Show your best foot forward. You know, when you go in, research about the programs before the interview day. Make sure you know what they do. Read in their website, what activities do they have. When you read through, then you can have genuine questions to ask. That shows that you have done your homework. So which means separated from the crowd, you are demonstrating interest, you know. So you need to prepare real well. And when you go to the interview, I mean, speak loud, be bold, you know, have humor. You be a human being. Try to make it personable and impressionable when you talk there. Don't go and be stoic like a robot. And I'm like, this person, you know, I cannot, you know, is stiff, is not, is anxious, is not, you know, is not communicate. We are human beings, you know, nobody is gonna chapa you or do anything to you, you know. So just, you know, be there, stay engaged, be interested, you know. Even if you get 30 interview, approach everyone as your last interview. Approach every interview just as the only interview you have. So make sure. Arrogance or lack of interest is a big red flag. And if you show that, programs will not even rank you. You won't even have a chance of remotely matching there because they are not going to rank you. So don't do that. So make sure, you know, you present yourself well and, you know, demonstrate true interest and do your homework. When you are interviewing, make sure you have good internet connection and reliable power. If you have some backup, you know, we know in our country sometimes have power problems, but really when you are interviewing, try to do the best you can. Avoid distraction somewhere where it's quiet. Lighting. I mean, practice Zoom, you know, the Zoom etiquette, the Zoom lighting. People will buy even extra light they put kind of reflecting on them so that they look well on the video. So make sure, you know, you find out how to present yourself well in Zoom, do some Zoom trial runs before you go for your interview, and make sure where you are talking to, it's well prepared, you are presenting yourself well. Zooming is a skill by itself. So you really need to up your game and, you know, have it well presented. Most resident programs have information on their website. So, I mean, when you do there, you read about, you'll avoid asking, you know, common questions. And most programs on the day of the interview, they'll give you a rundown. The program directors will tell you a rundown of the program and all those things. Listen carefully. Don't ask. The thing we hate is we finish talking to you about 30 minutes about the program, and then you come, you ask the same question that I told you. I'm like, were you not listening? You know? So per ACGME guideline, residents' work time is restricted to 80 hours a week, averaged over a month. So you cannot work more than that. And this is doable. and nobody will go above that. So for us, when somebody asks questions about workload, work hours, is a lot of red flags. So you don't need to go there. Don't ask that question. Because your time, if you work more than this, average of a month, the program will get reprimanded. So somebody is there protecting you. And they say that usually people will go like 60 hours and it's done, but it's doable. Nobody will kind of exploit you. I mean, I remember when I was doing my internship, I will enter Muhimbili on Friday and come out on Monday, you know? So we have gone through a lot of things in our training. It's not to that extreme. You won't be able to do that. After 24 hours, you have to rest for 80 hours before you do. There are other small caveat restrictions in such a way people cannot do those Monday to Friday shifts anymore. And so don't worry about your work schedule and everything. Concentrate on other things. If you raise this, it appears as a red flag, and I will strongly advise you not to consider it. You know, most programs have a clause that communication is not necessary, but after the interview. But you know, it's if you have a genuine question, you can ask. And especially if you are doing step 3, after you're done with your step 3, you can really email the program director and say, hey, I'm done with step 3, I passed, you know, we just need, and I'm still interested in your program. So you kill 2 birds with 1 stone. It's a way to kind of touch base and emphasize your love for the program, you know, that's totally, you know, allowed. I'm not sure how the line came there. I'll just continue. Create a ranking order list as soon as you are done with your interviews. You can keep editing up to the deadline, but do not wait working on it, you know? And so if you, once you finish your interviews, between submitting the rank order list, what I do is I just submit it. You can still continue editing it and then resubmit, but always keep it submitted. And what I was talking to Moza the other day, one of our panelists, and I told her, like, Moza, you need to submit. What if you go unconscious? You want, when you wake up from your coma, you matched. Because if you didn't submit, you won't match, and you'll be starting all over again. So don't play with it. There are issues of pre-match, and these are situational. And this is where you can top on our skills and talk. For example, if you just got 3 interviews and one program gives you a pre-match, go for it. Because your chances of matching with 3 interviews is low. You have a pre-match, 1 bird on the hand is more than 3 birds in the tree. But if you have done 25 interviews and you have done them well, you can decline a pre-match with the hope that you want to go to your best program. And this happened this year to Moza. She had done, you know, almost 25 interviews, and I think like 2 programs offered her a pre-match. And so she came to me like, James, what do I do? I've been offered a pre-match, and I'm thinking, like, you know, you're a good candidate, you have good scores, you have interviewed well, you can interview well. Most likely you will match to your top program. Write to them an email, politely decline, and leave the door open. And so she ended up matching to her best programs. And so it's a situational. So that's why we are here. You can ask us, like, what's going on, and we'll be eager to chip in and help you figure those things out. But it's really situational, depending on if you accept a pre-match or you do not. So in conclusion, you need to create a well thought of, strong application. You need to research your programs well. Ensure you submit not less than 3 reference letters. Submit your application in time. Make sure you submit your application in time. I cannot overemphasize that. Usually, when you submit your applications and the MSPs come out, then programs start reviewing. So people will think, like, when the errors open the application to be submitted, programs start reviewing right away. So 2 weeks down, when even the MSPE letters are in, people will be like, oh, I've not gotten an interview. They are freaking out. Relax. You have done all what you have done. Sit down and relax. The rest, what is happening, is out of your control. So there is always a silence in between. That's what I want you to appreciate. between submitting your application and program reviewing and start calling in people for interviews. People on the internet, in the blogs, they'll be posting things. Sometimes most of people on the internet, they lie. Somebody will come and it's September 10, even MSPE are out, and somebody is writing, I have 3 interviews. Nobody has looked at the application, I know for sure. You know, so there's a lot of lies going around. Don't fall a victim to that. I mean, stick to your guns. You have done your homework, and you know, keep waiting. When you are invited for interview, try to schedule as soon as you can. Read about the program extensively. You know, show up on the interview day, confident, prepared, shine. You know, give it 101%. Even if you have 50 interviews, everyone is like your only interview. Have that attitude when you go in, and you will prepare well, and you will show well, you will be liked, and they will rank you. Immediately when NRMP open up, I mean, the National Residency Matching Program now, create your rank order list and certify it. Always have your list certified. You know, have your list certified, and, you know, continue changing. You can certify, recertify, and recertify until the last day when they close, like you cannot do that anymore. We look forward to have you guys. This is the most interesting message that people get on the second Monday of March, with 3 words: you have matched. You know, these are the 3 most revered words. So we wish you luck as you apply, and we have to see many of these on your WhatsApp status, you know, I matched, you know, and it's really a happy time. And despite all the tribulation and all the challenges, this year, more than 9,000 international medical graduates matched, you know. So what you should go is, why not me? 9,000, you know. So it's go with a positive vibe. We get what we think we are getting, and we don't get what we convince ourselves we are not getting. So go with a positive mind. Knowing that, you know, it's one of, can be one of 9,000, you know, it's a euphoric feeling. You will have sleepless nights, happy nights, and, you know, and it's like a cherry on top of your hard work. So good luck, everybody, in your application. I hope to see you all in the panel next year. I mean, on this other side of the panel where you are sharing now your experience. One thing I want to insist is for everybody is really to intentionally think of giving back, you know, intentionally thinking of mentoring other people. No one, even the people you are applying with this year, no one between you is competing with anybody else. You are competing your competition is between you and yourself, me and me. You're not competing with anybody. And don't think like anybody who is here is going to jeopardize your chances of matching. And so I want you to go with this attitude. And even when you match, you know, turn around, give back, carry the other people, you know, share your limelight and bring them up in such a way that, you know, they go through the process and be a guide. I mean, really make an intentional decision, you know, to help. And I really appreciate our panelists, people joining from different parts of the world and willing to help you guys. And it's really, we're looking forward to create a cohort and have people involved and help. Well, congratulations, Moza. This was her picture she shared on the match day. And, you know, I just decided to put you on the spot. And it's time for questions, discussions. Open the mic, and let's hear from everybody, and as we continue talking. I saw some messages went into the chat box. I'm not sure if there are questions which came there. We can tackle them first, and then anybody has been looking through, and then we can take questions, and then of course, and then I'll try to bring in my panelists to kind of chip in and share their experiences and all those things. No questions you are posted there? Hesbon, it's almost 1.5 years. I mean, what are you thinking? Anything I missed? Anything you want to add in?
No, I think that was a very nice presentation. I just want to see if these people have any questions, anything else they want to know. But that was a very, very short introduction. A good presentation.
Yes, Dr. Koola, that was really good. There is a question on the chat. Somebody is asking, as for the MSPE, is this something we will need for ourselves as IMGs? There was something Dr. Barbara alluded to in regards to timeline for things needed from their school. What were these?
So the MSP, I think even international medical graduates require MSPE, because I remember contacting my dean and going to Muhimbili to talk to my dean to have my MSPE. Say yes. So even IMGs require those MSPEs, and it's my understanding that it's a requirement. Unfortunately, I mean, Hesbon, you applied last year. Did you get your MSP from Cuba? And can you share your experience?
So different countries, I think, have different systems. For the way the US medical students get their MSP is different from international medical graduates. From Cuba, we get MSPE, but the difference is that the school doesn't upload the MSPE to the system. We just get it and upload by ourselves, but you have to make it because the school doesn't make MSPE for you, but they give you the guideline, like this is how the MSPE should look like. So there's some of the things that you're responsible to do by yourself, and then your professors have to go on and put in some information or something that's like a short recommendations of how you've been going through your medical school, and then they sign it. But it's different from the way US medical students get it. But yeah, every single applicants need MSPE. You just have to ask your medical school how to go through that. Although those some medical school, they will be like, I don't know what this is. I have a friend who applied last year, who much DC actually. He didn't have MSPE, and he went to us to the school. They say, we don't know what that is, and we don't know how to help you. So he reached to ESFMG and explained the situation, and he applied without MSPE. But I don't know if that happens to everybody, but that was just one person that I know.
I would also add to that, I went to a session where it was like program directors and APDs for international medical graduates. And one of them strictly said that they do need an MSPE regardless of like where you are. And sometimes they do not choose IMGs because they don't have an MSPE. So if there is an opportunity to get an MSPE done, you should do it. And the reason why she said that was like, she said that they needed the MSPE to be able to compare each student, especially with the clinicals, with the 2 years of clinicals or however many. So I think that's why it's important. Like, yes, you can be great academically, but they want the comments on the MSPE on when you did your rotations. And I think that's why it's important.
James.
Yes, sir.
Yeah, I'll add to that from my experience. Obviously, it's a challenging thing, and the system here, tries as much as possible to standardize things for everyone, which is fair, but systems are very different, right? For having trained in different countries. So one, it's a requirement for everyone. And in my experience, I remember, I'm talking to my professors back in KCMC. Like you said, nobody understands what this is because this is not what they're used to. What did I do? I went and researched for what an MSP is. The templates, just excuse me, I'm going to step out here. Yeah, I researched what an MSP is, what the templates were, and from that, I understood, okay, this is the gist. They want a sort of a fair comparison of just a paragraph of this student's experience in the clinical rotations. What did they do? What is their participation? So you can kind of understand. It's like, from our experiences, what is the perspective from the clinical experiences that we had? What was that? And so I wrote something, and like you said, the school, I think it was Moza who said that the school, from our perspective, would be giving the letter for us to upload. Sometimes it may be vice versa. You may have to write that letter and provide it to your dean. Usually it's written by the dean to upload. But whichever the case, you need to be prepared, because the last thing you want to do is to make yourself to show, to hamstring yourself, to shortchange yourself, so that, because people are not used to do things. If people are set to do things a certain way, and you're telling them like, oh, overlook this, it's just, you don't want to, it's just a letter. And it's a representation of your clinical experience, and you don't want that to be the thing that, that offsets you from everybody else, or makes you lacking in any way. So unfortunately, that's an added step. And sometimes as physicians, sometimes we're not comfortable to sing our own praises. But in this case, I'm sorry, be prepared to do that. Be prepared to do this for once. I was very uncomfortable when I was doing it myself, but I think you need it's a game, and you need to prepare to play the game. And if anybody is in, I think I still have a draft of what I wrote. If you need that, feel free to ask Dr. Koola, and we can provide those resources to you. Thank you.
Thank you, Edward. So one person is asking a question. Please explain about pre-match. So when you apply for residence, you go through the match goes through NRMP, National Residence Matching Program. But there are other programs that decide, they think like when they go to the match, they might not get good candidates. And so what do? They decide that we are not going through match, but we're gonna offer our positions before the match. So the match is coming in March, but in January, they email you like, hey, we really like you. We think you will fit here well. Will you accept to be our resident? Of which then if you say you accept, then you are offered a pre-match before the match. And so if you accept, then they send you a contract, you sign, and they tell you to withdraw from the National Residence Matching Program. So you have committed to go to that position. So that is what pre-match means. So it's getting a position outside of the match. And these are the programs. And so like the top-notch programs, they want to go for pre-match because they know everybody wants them. So it's like, why do you want? So when somebody wants pre-match, probably there are questions. But if you got just 2 interviews, or it's just your only one interview, you're going to jump into that. So it's different. It's situational, depending on a situation. You might accept, not accept, and you have to judge your situation to know what will work for you. Because at the end of the day, you want something that works for you. You have to make sure you protect your interests. So I hope I answered that well.
And Dr. James,
yes,
in addition, with the MSPE, I know as from Wimbili, as Edward said, you give them the template and then they fill in. So you always have to ask them with what you want. So it's not a problem. You just give them the template and then they will fill in. And from Wimbili, they've been doing that a couple of years now. So they should have a prepared template by now, because I know there've been lots of candidates recently in the last 5 years.
And that's why importance of having this group. So in case now they have a new dean who has not done that, which is not uncommon to happen. Now, people who have applied recently, last 2 years, and then they can share all the information, and then you can educate the dean who is there. I mean, part and parcel of doing this process is sometimes you become like a trailblazer. You know, you discover, you put structures in place, and you leave them for other people to help. So more than I think you should be ready. You should be helped, and you should be ready.
Yeah, just hi. Sorry, just allow me to give my story. I think it's very similar
Come,
to
Barbara.
what you said. Yeah, but I was so I'm Barbara Dak, as Dr. Koola mentioned, PGY2 currently at Griffin Hospital, pursuing a double NRMP residency, and I graduated from Kenyatta University. I was the first person to ever do USMLE for my program. So you can imagine all the teething problems that were there. The only thing is I was very persistent. When I hit roadblocks in the office, I went to the dean, and thankfully the dean was very supportive, because MSPE is something they've barely even heard of. So thankfully I got someone who was able to just walk me through and believe and do it. So it's very possible. If you have people who've been doing it for years, definitely ask questions. Yeah.
Yeah, just to add to that, I was also coming from a KSMC at the time when we were coming. I and my colleague Israel Kasago, who is a pathologist. We, you know, when we were applying, I think we were the first people from our school. So unlike Muimbili, for example, they had this, or we were not aware, but there will be obstacles, and you try your best. I mean, being the first, more than often, if you're coming, you may be the first person coming from your school, and you have to have a very good report as much as possible to the dean and the administration staff. So it goes without saying that you need to have good relationships at all times. In medical school, at all times, make sure you just have good relations with everybody, because like James said, the world will conspire to make sure that you succeed in your goals. Thank you.
Thank you. Any questions from the crowd?
Yeah, there's another question here. Is an MSPE prepared 5+ years ago, when one graduated from medical school, still valid? I think this is a good question for Dr. James. Since
Yeah, it does. It used to be called Dean's Letter. It's called MSP. I got mine 12 years post-graduation. 5 is not, it's just a big change. It doesn't matter. Even if you graduated 19 years ago, they still want it. And yeah, time is not a factor really.
And there's also another question asking if all residence programs offer online interviews currently.
I mean, I know for Internal Medicine, Association of Program Directors in Internal Medicine, they had a meeting and they agreed. I mean, most programs, almost all the programs in Internal Medicine are doing Zoom only. Now there's an issue of equity, diversity, and inclusion, and they think like the minority will not have the resource to travel all over the country doing people used to have a budget of up to $10,000 just for interviews, because those flights can add up. I mean, you fly to different parts of the country, you need a hotel, you need, so you need a day before to be there and be there for the interview. And so sometimes they'll have post-interview activity. So it's like 3 nights you stay. So it used to be a huge budget. So it was a very big restricting factor. So I know for internal medicine, almost all of them are doing Zoom only. And most of the programs, when they want Zoom, they don't want Zoom and face-to-face, because then you have bias. Because me, I met you in person. This person I met in Zoom. And so they are kind of linked. But I don't know about other specialties. I don't know about room. I don't know about orthopedic, surgery, and all other things. So, but most things are online. You go and you can Google, you will find, and you find exactly who is doing what. So, but it's mix and match.
If I apologize. If I just want to add to the interview process. If you get a chance or if I think this is obvious. If you have an opportunity, unless there's significant circumstances preventing you from having an in-person interview, I think an in-person interview trumps, a Zoom interview. So you should go for that. And another thing, I'm sure we're all very confident people to become a doctor, but one of the things I remember, one of the program directors who interviewed me, it just is transparent, is that during the interview, you're selling yourself, but when you get the interview, you're in. You're almost in. So have confidence that you're in, and project that you're confident despite your circumstances. Like James said, don't bring your problems to them. When you're there, you need to convey an atmosphere or an attitude that people say, or most of the time, the people actually who will select you most of the time will be the residents. The program directors will ask and seek the opinion of the resident. Hey, do you think this guy or girl is going to fit in? Will they be a good fit? And so you don't want to be there. Whatever problems you have, you leave those problems behind. Convey an attitude that you'll be a person that is enjoyable to work with. That's very important. And have a confident and a positive attitude, right? Always keep a positive attitude. We have, and I'm sure you've overcome so many obstacles. There are so many challenges in the world. But the last thing, no matter where you go, nobody wants to be with a person who's miserable or is unhappy. So I think those are very small things, but you'll be surprised. You go to interviews and there are people who don't have interpersonal skills or just exude an attitude that you're saying, really, this person is excellent on paper, but in real life, you'll be surprised. So these are things that are important, especially because this journey, you're walking most of the time alone. And so you're going to this place, you haven't spoken to people, you haven't interviewed, you have not interacted with people for a long time. So I think it's very important to have a positive attitude. Thank you.
Somebody is asking the question, what about clinical observership? Is it a requirement? So I will answer it in various ways. So observership is really you getting clinical experience, so doing some rotation. So when I was doing one-on-one, I told the medical students, if you want to do, you are thinking of doing USMLE, doing residency in the US, try to get an elective as a medical student to a US hospital university. And then from there, you'll see patients, you'll present, you'll do all those things. That's the experience we talk about, we call it observership. But you need that, and I emphasize why, to show your commitment to the profession, to show you know what you're applying for. But I will say that you don't really need to come all the way to the US to do this. I have an example of 2 Ugandan guys. So when I was in my 4th year, I rotated in Uganda. I did an away rotation in Uganda. And so I met these 2 Ugandans who were kind of starting to study for the USMLE. They are working with Uganda Baylor. They have they were starting a pediatric hematology oncology program in which faculty from Baylor used to come there to kind of teach the fellows. And so these guys were there, they are medical officers, they are kind of running clinics for the research programs that they are doing there. And they'll go to these seminars, they'll present cases to the faculties from Baylor. And guess what? They finished their exam in Uganda because they didn't do step 3. They did step 1, step 2, and they did the English exam. And then they got all the letters from Baylor faculty who used to go to Kampala. and they matched. So the first time they stepped in the US is to come and start their residence. So that's why I was alluding to, like, if you meet, like, American trained is working and you work with them, they give you letters. It doesn't matter where they give you the letters at. And as I say, clinical experience and observership, it really does not have to be in the US, but there are different scenarios where you can get them and kind of have a strong application in. So that's all about, clinical observership, unless you have any follow-up question. And guys, you can unmute the mic, and talk. Kind of struggling going between reading the messages and making and talking.
Hello.
Yeah, Pauline, come on.
Yes, I had a question. I had posted about it on the group, but I think I can direct it to you. How important is step 3 for you personally when you're reviewing applications?
So, I look at it in different scenarios. I'll tell you, like, from my personal experience, what I feel and what I don't feel. Let's say, for example, you graduated more than 3 years ago. You did your step 2 like more than a year ago. You have come to the US, you have done observerships, and still you're applying to me, you have not done step 3. I'm like, why? You have all the time, you are here in the US, you had an opportunity to do it, you didn't do it. Now it's coming to 7 years post-graduation. When you have done step 3, it means you are ready to do your complete residence training. If you do step 1, step 2, and you get your ECFMG certification, you can train to PGY2 or you can start PGY3, but you cannot graduate until you pass step 3. And for us in the programs, when we bring you in, we want you to graduate. Unlike our countries whereby the professors want students not to graduate, here we want our students to graduate 101%. So when you have done step 3, you are unconsciously telling me that you are ready for full graduate medical education training. There is no setback. And so for me, you stand out, you shine more than somebody else who has not done their step 3. And just to add, other programs want people to pass their step 3 before they give them the second year contract. You come here as an intern, it's a steep learning curve in July. It's a new medical system, you're using EMR, it's a different culture. You have a lot of things to learn. Now you have not done step 3, you're also studying for step 3. Guess what? Your performance is gonna compromise or you're gonna fail your step 3. So it's risky. If you have done it, it's very good. It will not restrict you, but it's an added arsenal to your success channel. That's how I can summarize it in a nutshell. You guys, Hezbon, you can add if you have anything to add.
I think it's always a good thing to have step 3 done before residency. That's according to me, because during residency, you don't really get enough time to go again, start for step 3. You're doing internal medicine, get again time to do pediatrics, OB/GYN. If you have time, just get it cleared before you start residency. But yeah, it's my opinion that get it done before you start residency.
So I also understand that for the people who have done their rotations in like the Caribbean medical schools, there is like you get to do rotations in the US. For those who are who are IMGs, but they didn't study in any of the Caribbean medical schools, maybe any one of you can share how they got to get chance to go. Like there's a lot of issues. For example, if I wanted to go to the US to get a US clinical experience, for example, this would be like using a tourist visa, or like I'm not really understanding like where would I start with this whole
That's a very good question. I don't really have that kind of experience, like coming out of US to come do clinical experience here, but I have friends who've gone through that. The kind of visa you apply is tourist visa. You just like a short stay in the US and then you do rotations, but make sure you have all those connections, like you know the people you're gonna rotate with before coming here, because it's a very short time that you're gonna stay here in the US. So if you have people you already know that you'll be working with them here in the US, you make things go smooth. That's the only thing that I know. And you have to find hospitals or programs which offer those clinical experience or observership or professors or attendings that you want to work with, because like not every single programs, like in my program where I work, it's very, very hard to get clinical observership. So not every single program allow IMGs to come and do observership. It's sometimes kind of complicated, but if you have people you know, like attendings or some programs allow you to do, like I know some programs in Florida or Griffin Hospital, they have like official websites where you can apply for clinical experience. If you get accepted, apply for visiting visa, tourist visa, and then you can do observership.
Jim, so I'd just like to add two things regarding step 3. My experience was I went and specialized in radiology, and I remember it's a requirement. We're required before going to diagnostic radiology residency. Our program wanted us to be done with that. So I think it's important, and it helps because, especially like in our field in radiology, it's not, we're not dealing directly with patients, and so I don't want to say it's completely different to medicine, but you can understand, we're looking at images. We're not going to be seeing patients day to day. And so I think it's important to be done, especially if you're subspecializing. And, you cannot say enough, to finish it before the requirements, day-to-day requirements of internship or residency. If you can get it out of the way, it's best that you can, but do not take more time to not apply to say, I really need to take an extra year before you apply. Regarding visa, I cannot speak very specifically to that, but I will say for anybody, most of you who are joining us are already far away in the process, but I will say that, for example, in Tanzania and maybe in Kenya as well, one of the things, if you're determined, you decide that this, obviously you're going through this process, you've decided that you wanna pursue further learning, and you maybe want to practice here, or definitely want to practice here, to apply for the lottery for green card, if that is an option that is available that you can afford. I think that's important, because some I didn't have to do it personally, because I was privileged to have a visa to be here in the US. But I know colleagues who applied, and it really cemented their application. If you can get a green card from the lottery, the opportunities are there, and there are many, and they go unapplied for almost every year in Tanzania. So I would say that, if you have that card option, take it and try that. But the like somebody said before, it's a challenge to get observership clinical rotations, and that's why we in the community, like James was saying, we should give back, and that's why it's important to have a community of people who have gone through this process, and see as much as possible how we can give back. Thank you.
Here's
Yeah,
another
just
question
to
here.
add
Yeah.
on the polling question about coming to the clinical experience. So I'll give their programs. I mean, as he said, we have one in my hospital, but also you should be very careful. They are what we call letter factories, where they'll tell you, like, you pay $2,000, you rotate and you go there, you're not really seeing patients or anything, and then they write a letter to you, which is very generic and which does not really, is gonna harm you more than support you. So the best thing to start with is your country people from your country. I'm not sure, Gola, if you're from Kenya or Uganda, but today we didn't put our countries in front of our names. So, or Tanzania. But you start from them who are in the US and trying to see if they can offer you opportunity to kind of rotate with them. And it doesn't have to be a hospital. You can rotate with somebody in their clinic and it's still a clinical experience and they can give you a letter. So that will be a good starting point before you go to those payment programs, some of which are scams, and programs know them and they tend to review candidates who come from those programs very negatively. So, you know, you want to give yourself a chance and position yourself to succeed. And it's something you have to put into consideration. Now about the visa issue. Most of the people I've been mentoring, you know, before we started this formal structure, I used to kind of communicate with people personal, and I have a couple of people who are in the program, like doing training. And one of the things which we did intentionally was, when they are applying to come for clinical observership, to be the time also they are sitting for step 3, because step 3 you can only do it in the US. So I tell them, hey, you have done step 1, step 2 in Tanzania, prepare for step 3, be ready for step 3. When you come, you do step 3 and you do your clinical observership. Why is that connection important? Why is that connection good? Step 3 can only be done in the US. So when you go to apply for visa, you're coming to do step 3, and step 3 can only be done in the US. You can show you are ECFMG certified, you have done your step 1 and your step 2. You get your visa, you have your case, you know? So of course, as a tour, as a visitor, you cannot work, which means you cannot be paid or receive payment. But then of course you're doing observership, you're not working, but it's hard to tell somebody in the consulate, I'm doing observership. Oh, so you're gonna work in the hospital, you know, and you don't hear it well. You think like he's saying you're gonna be a patient in the hospital. You say yes, and he's like, you don't have a work permit, no visa, you know. So you shoot yourself in the foot already. So you have to kind of think in the broad picture to see how you position yourself to succeed. But I think mostly relying on your local connections. And that's why I said, in my last slide, I said, you guys, as you go through this, let's look behind, let's make intention to support other people, you know, so that next time, when we want somebody to do observership, we say, hey, call Ogola in Columbus. She's going to do observership with you. Or call Luce Light in Missouri. She's there. She's going to, you know, so we need to build this network and intentionally support people to be able to go through the system, because I mean, yeah, we have to, please, I cannot overemphasize that, and I'll keep overemphasizing it.
Can we have more information on the certificate of good standing? When is it necessary, if at all? So after there's something we call pathways, which is you are, after the steps 2 CS was discontinued, now there's different pathways for application of residency. For pathway 1, that is if you're licensed in another country outside US, you have to submit your license, and along with the license, you have to submit a certificate of good standing, which you get it from your government. I know it's not a complicated process back in Tanzania, but I don't know about other countries if it's complicated getting it. But it's you have to pay the government like $100 in Tanzania, and they give you a good certificate of good standing. And along with that, you submit with your license. That's it. So that's if you're going through pathway 1. that you have a license to practice in another country outside US. If you don't have a license in another country, you have to go through different pathways. There's 6 pathways for application.
So somebody asked about what's about research experience and publication and their consideration for all programs. I mean, it shows it's not that we require it, but when it's there, it shows your commitment. It shows your scholar. You know, as you train, for example, you're applying to university program, they really expect you, you know, to be a teaching attendant, which means to continue to do clinical care and do research. Guess what? If you have 20 publications and you are research sound, you are more to succeed than somebody who has not. So it will shine good for you. So it's those things that will add to you, but if you don't have them, they don't kill you, but, you know, and that's how I'll explain it.
I wanted to also talk about something else that was a little bit new to me, was signaling when you're applying. And I think maybe, I don't know if Dr. Koola, we're going to be talking about the application, like eventually, like in details, but there was this signals. And so when you're applying at the end for internal medicine, I think they gave us like 7 or 9 signals. And what those signals were supposed to be is to let the programs know that you like want them. Like just applying to them was not enough to let them know that you want them, but like you also signal them. But what I came to find out, I think it's program dependent, and also it may not necessarily like matter as much as I thought it did. Because I would say from some of the programs that I signaled, maybe I got only 2 interviews from those programs. And then I got like other interviews from programs that I did not even signal. So I was going to say, especially with the signal, and I'm only putting this information out there because I really took my time to try and signal these programs, only to find out that it's really program dependent. If you want a program very much, you try to like personalize your letter, as Dr. Koola was talking about earlier, and just make sure that everything you do, your communication is as par with that.
Yeah, signaling is one of those new technologies, and they gave you signals because, as I said, with online application, people are applying to hundreds of programs. So they give you a limited number, like to say, these are my top programs. And I tell them, you know, I really love you. And so, frankly speaking, I'll tell you, last year, when I was reviewing application, I didn't know even the signals were appearing. I didn't even look at them. I was leading the personal statement, those people who have done, you know. So the person who was asking about experience, you're applying for IMPM. I see you worked with UNICEF. You are doing a child vaccination program. You know, you are doing IMCI. I know you know the butter and bread of preventive medicine. I want you, compared to somebody who has not done anything. So for those, so I was looking for those, and they are stating in their personal statement, why is prevention important to them? So those are the things. So the more, I was mostly reading from the personal statement, looking at the activities and narrowing down my people for IMPM. I never know where the signal stayed. But I heard the IM APD talking, oh, this person signaled the program. And like, so they are looking at the signals and kind of, but frankly speaking, it's hit or miss. So, I mean, if you look, one of the things, all the people who are here, all the people who I put as people who have done at least step 1, when I emailed you, I intentionally put your emails in the 2. I didn't use BCC because I know you are a committed crowd. You are already, I mean, you have put your legs in the water. You are in the process. And I did that purposely because I want you to see each other emails. I think you should communicate, you should touch base, you should share experience. And that's what, intentionally, when we started this road through, we decided against doing WhatsApp group and those informal communications. We want everything to be very formal, very professional. It's email, it's Zoom, it's, you know, and kind of to cut down the crowd. But I intentionally put you guys in the two because I wanted you guys to see each other email so that you can email each other. Because I believe now you are not meeting doubters anymore. I'm not Tommaso Tena. There are no people who are asking to see the wounds. So you are all converted and you are kind of going in the same vehicle. So you can band together really. And yeah, and when I finish, I will send the recording through the same group, and I will include everybody in the email. And of course, I'll ask the panelists, those who allow me, I'll put their email in there visible. And then you guys, you can pick over from there and kind of chit chat and have help. But do your homework. Don't ask obvious questions. Always I say, do your research. Come to me with your opinions. You know, I look even on my resident, you go and clock a patient you're presenting. I want to see what's your differentials. Are you going to treat this patient? I don't want you to, you know, dictate to me. You have questions and you're just asking. What are you thinking about? What do you think? Why that and not this? You know, so make sure you do your homework and then ask real genuine questions. And then you can ask help when you are really in dilemma. We are there to help and we'll try our best, you know, to help and make sure that you succeed. Yes, we see you unmuted yourself.
Yeah, I have a few things to communicate. Of course, thank you for the presentation. It was very good, very detailed. And we cannot overemphasize on the attitude. I feel like residents, like once you don't have a good attitude, even if you are smart and all that, it's gonna pull you down. So attitude is everything, you know, going to start the residents and also in your interviews. I actually remember my prelim interview, which I didn't know. When I went to the interview, I was the first person to speak to the program director. So I was done like in 20 minutes, I was already done and I almost left. And the program coordinator was this African-American lady. So she was just chit-chatting with people and she said, oh, if you're done, you can leave, you know? And then something just allowed me to stay. So I stayed and we were chit-chatting and she was talking. She was doing all these community works. And I happened to share an experience with how patients in Tanzania, in Muhimbili, you know, as doctors, would give money for medicine, for you know, for them to buy prescription, and patients would come, they have not eaten and all that. And because she was that person, charity and all that, so I was able to connect with her on that level. And I matched there. So it's those little things, the attitude, somebody can see like, oh, so she's a nice person. She's a person I can work with. She really cares about patients. So all those little things, attitude, you might not even know people are watching you, but people are watching you. And even when things happen in residence, you know, later on, somebody can make a comment and then you're like, oh, somebody really watches. So people are always watching. When you go to work, the nurses, other staff, everybody's watching. So you put all that into consideration. Your attitude really goes a long way. And also with the groups, the people that you're studying with, it's very important. These people, you know, sometimes maybe Dr. James won't be around, Professor Minja. So these small groups that the people you are all doing the same exams with will really cheer you up. So from my experience, I did exams. We had a group when I started all this. James was my initial contact person. He has gone to school with my husband. So he was like, you find James and talk to him. I know nothing about medicine. And after that, I was able to meet Frank. I met Mabusi. So all these people, we had a group discussion through Skype, you know. Me and Mabusi came to meet when Mabusi came to New York, you know, when he started his residence. But these are the people we were talking, we were doing questions, we were consulting for everything, you know, and we had not even met. It was just through Skype, and luckily both of us have matched, you know. So those small groups are very important. Like the people that you are doing the journey currently with, you know, somebody's also doing step 2, somebody else is doing step 3. And the thing, like, all of us were different. Frankie had finished step 2, he was preparing for step 3. I was preparing for step 2, Mabus was preparing for step 1, but we were all studying together, encouraging one another. So those small groups are very important for you guys to stay together. And as James said, you're not competing with anyone, you know, you're competing with your own self. So you can be the best to your own self. So don't worry like, oh my God, both of us are applying. What if we, no, you're not competing with anybody. You do your best and put your best foot forward and all will go well. That's it.
Thank you very much, Winnie. And I mean, it's really important. It's really, and that's intentionally. That's why in the one-on-one and the 201, I always use BCC, because I know there are people who are just trying to test the waters. How does it look like? You know, somebody has the audacity to find my number and call me and like, oh, you know, I'm thinking of doing USMLE, but you know, I'm now a specialist and I cannot see myself studying anatomy and biochemistry. I'm like, why did you call me again? I mean, is this for real? So you have to avoid, and there are people who are so, pessimistic. It's like, this does not happen. It cannot happen. It happened. That's why you have Mabu, you have Hesbon here, you have Moza here, you have Barbara, you have Winnie, you have Edward, you know, we have Frank. So it happened. It can happen. Yeah. Just do your best, show up. And I said, I mean, I think we need to try to reiterate that whenever you do observership or you are doing interview, you are under microscope. There's one thing which I have written down, and I remember I didn't talk about it. Now we are doing Zoom interview. Guess what? If somebody is on their phone, when we are in the program, we can see, like you can see somebody's reflection of the phone in their eyes in the Zoom. And so somebody is interviewing and he's on their phone. Guess what? I mean, like, I'm not even gonna, it means you are here just by body. You are not vested. You're not interested. I don't want you. The worst killer is, I will rather have a committed, interested resident who passed with borderline than a super genius with 290 who has no attitude to medicine. I will teach you medicine. We learn medicine together. No, we learn medicine together. Everybody is learning medicine every day. You go, nobody knows everything in medicine, and that's the beauty of it. So everybody is a student for life. So I'll rather take somebody who has good work ethic, good attitude, and teach you and learn medicine with you, rather than a super genius who is arrogant, does not care about the patient, is not a good team player. You avoid that. You know, go pele kama ukoma. You know, ukoma is leprosy in Swahili, and you say like you're scared of lepros. So yeah.
Yeah, and they know people can be disqualified in residence for that. I shared with you, James, of one lady who was disqualified. They discontinued her, and it was all attitude issues. Team player, she would lie about things. They would send her to see a patient. She would come and lie. She would present things that are not there. She would order things that are not supposed to be ordered. She would not work well with the seniors. So they eventually disqualified her in like 6-7 months into her first year. So attitude is everything. And as you said, we are all learning. And most doctors that I've worked with, they'll say, we can always teach you. You can always study. You can always know these things, but we can never teach you to have a good attitude. So if you don't have a good attitude, you can't work with peers, because you'll be a first year, and then like now you're gonna be a second year, you are a senior, you have to have a team and manage a team. And there have been scenarios where second year is like the worst, you know, they don't know how to handle the juniors, they don't know how to work with others, you know, you sabotage your colleagues, your juniors, instead of helping them. So all these things, people are assessing you. And some of the attendings won't even say much when you're rounding with them. But then when something happens, they have all these inputs about you. So you really have to watch out what you do in residence and in your interviews, because you never know. A small comment, you know, somebody might have observed might save your life for forever. Yeah.
I also want to just add a little bit more to that. In this journey, not only, do you have to have a positive attitude yourself, but it's also important to have people around you who are positive. In my journey, I remember speaking to Dr. Minja, Frank Minja, and I have doubts. I'm not sure. There's nobody who's come from our college, and Frank is telling me, Edward, whatever whatever your potential, whatever you aim for is possible. He was telling me this, will manifest. Whatever you believe in, whatever you work on, is possible. What do you want? What do you want to achieve? Go for it. And I'm here doubting, is it possible? I'm working. Once he told me that, it's unbelievable. And not only, him, but, other people, but it's very important, a small message, especially after we've succeeded in our journey, to look back and to give positive feedback, to give encouragement to people who are going through this process. And while you're in residency too, residency is a challenge. Keep a positive attitude and work hard. You may not know anything. I mean, I can tell you very well from my my specialty, radiology was like Chinese to me. Everything I looked at, I felt like it was a completely different language. But one of the things that I made sure was consistent is that nobody would question my work ethic. Okay, nobody would question my work ethic and my desire to be better. You will meet many people who are very privileged, who are very in this system, but they even today, unfortunately, I hate to say this, some of my residents at the academic institution, they have all they may have all the skills, the tools, they're born here, they're trained here, but you can clearly see somebody's not, is not interested or is not working hard enough. And I think you do not want to give somebody any chance to say that this person is not here to progress, right? You want to have a positive work ethic, you work hard, and you have a positive attitude. But also very important, once you overcome the hurdle, to pat on the back those who are going into this process. Very, very important.
And just to add, usually after you match in March, before the start of July, I like meeting with the kind of the people who matched, and kind of give them the tidbits of how to succeed. And Moza, I've not spoken with you yet. I'm gonna find you. And even, Hezbon, Mabusi, all those people who have matched, I'll come and, hey, this is how you need to carry yourself. This is how you need to present yourself, showing up timely, committed, demonstrate interest. The other things are learnable. So it's small things which you might take them for granted, but they might swing the boat completely in another direction. You end up being thrown away from a program. And in real sense, from administrative standpoint, we want to graduate our residents 101%. But if somebody is a team killer, has bad attitude, does not care about patients, you have no place in medicine. And, so there's nothing there about your knowledge. You might be very knowledgeable physician, but really medicine, is science and art, and you have to bring that humanity part to it. And it's really important. So we'll talk more when you match and we are talking how to go and kind of talk about that. But you guys, any other, looming questions, anything you want us to kind of address and clarify? We're almost coming to 1 hour and 45 minutes.
Also, before we end, I also just want to say something for the people who will be applying this year. I know that the process may seem very overwhelming, and I'm saying this from a person who has just gone through it. And I will tell you, right before September 28th, when the applications were due, I was going over the personal statements, the eras, everything multiple times and wondering, is this going to be enough? But then later, once you start getting the interviews, you start to realize that, okay, we were really stressing out, but like, it's going to be okay, because like the wording and everything, yes, it's important, but these people also want to see your personality. I know coming from Kenya, like some of the things, when I tell my parents even how these interviews are set up, like sometimes we don't even talk about medicine. Some of the interviews, they ask you like, I know Dr. James knows this as well, like what's your favorite animal? Like questions that you don't even think would happen at a medical like doctor interview according to our lives in Kenya, because we're very like rigid. But here they want to see more of your personality. And I'm saying this to like encourage you all to continue, yes, doing great, but also when you're submitting, it's okay to add a line from your favorite movie in your personal statement if it connects with what you're saying. But don't think, oh, this is so out of it. And I'm saying this also because they ask you, tell me something about yourself in the interview, and I will talk about just my name and how it means a banana. Like it's just random things, but I feel like bring a lot to you. So don't be afraid. Of course, like be professional, but like don't be afraid to show your personality. And lastly, I also want to say that if you keep up and if you show that your passion, there's people in this group who will be on your back and like always wants the best for you. And I'm saying this because Dr. James has been there for me throughout this journey. Sometimes I'll just get a call. And one time I was actually in Kenya before I submitted my my match order list. I was really procrastinating it. And one day I just received a voice note and he was like, have you submit rank order list? What I'm going to advise you, where submit to. The worst case scenario is wewe umepata something happened, uko kwenye koma, ukiamka unataka kujua kama uko kwenye umematch. That's the worst case scenario. So like whatever it is, just submit it. And I'm saying all of this to say, wewe ukiwa na watu, ukionyesha kama unataka kufanya na unatia bidii, watu wapo ambao watakuwa wanakusaidia na wanakujulia na wanakutakia mema pia. So it's gonna be okay. Good luck kila mtu.
And as Dr. Moses said, I think, if you show it, people are going to be supporting you. And last thing I would say, don't listen to people who have not even attempted step one. Don't listen to those people. There will be lots of people who say, oh my God, you're wasting your time. Don't do it. Because as for me, I was an old graduate. I had like all the red flags possible, you know? So year of graduation was like almost, I think it was almost 7-8 years when I was applying. So some people just like, you're wasting your time, don't do it, you know, don't do it. But these are the people who have never even attempted step one. So don't listen to anybody who has never attempted even a step one. Don't listen to those. Listen to the people who have done the exams, have tried the match, and we see the results, because these are the people, some of them we have studied together, we've discussed things, and they will always cheer up. And as Dr. James mentioned, I matched into prelim. Actually, I didn't even know what prelim was. So it was somebody else from the group who told me they were in the program, say, just apply prelim too. And I just did it. I didn't know what it was, but I ended up matching there. And when I told James, and I remember I had texted Ninja, like, hey, the results are out, and you know, I matched to prelim. He sensed from my message I was not thrilled, and he immediately called me. It's like, hey, Dogo, what are you doing? You know, he was like, go out, have fun. You matched. You are in the building already. It is done. You're good. Go out, have fun today. So these are the people who cheer you on. And as James said, we also have that responsibility, you know, to help others. I've had friends, this year I have a friend of mine, a colleague of mine who marched into Dr. James' program. And I graduated medicine in 2011. You know, do you know how that's like way? But if you have the resume, you know, the research and all that, the perseverance, don't give up, but listen to people who have done it, you know. So don't listen to people who have not done it, please.
Barbara, your moment. Give us
Yeah,
some
thank you.
closing words of wisdom from Nairobi.
Thank you so much for this opportunity. You guys are all so wise. I was like, I wish I was doing USMLE right now. To be awesome. I think one of the last, and congratulations, Mo, I was super proud of you. One of the last things I think I'd just like to add is just how to like fashion your personal statement. You know, I think as Africans in general, we're very used to downplaying all those very things we think are small. They're not small things. Like for me, I was applying for internal medicine and preventive medicine program. Let me tell you, I learned how to just take all those small volunteer opportunities, and I say small volunteer opportunities that are right there. There's small ambitions to just start research in my university that probably never went anywhere, but were just being fashioned into the public health sector. So please don't downplay any opportunity that you have, because believe me, Americans are quite loud in how they express themselves, in how they in the very small wins that they take as very huge things. But for us, we're taught if you're loud, you know, you should be humble. Don't do that. And please have someone go over your personal statement. I think Dr. Koola said this already. There are very many people who would help you and look at it from a different perspective, because how Americans read things is probably not the way we do things. So if you have a team here who's willing to help and listen and just go for your personal statement with you and be like, oh, this is probably too much, this is maybe too little, and you've done more than you think you are, because most of us have done more than we really believe we've done. Use that opportunity to do it. So thank you so much, Dr. Koola. Always a pleasure to be part of the team.
Hesbon, anything from Tennessee?
Well, I don't have a lot of things to say, but all I can say that everything is possible. There's nothing impossible. If you decide to go for something, just go for it. When I was starting my journey for residency, I was preparing for steps. I was like, man, am I gonna match go residency in the US? I don't know anybody there. But I did my step one, then I met James through Facebook, then tried to give me how to go through all this process. Then I met Mabusi. We're in the same country in Cuba, but I wasn't really sure if I was gonna match in this country. But I kept going, doing my steps, and everything was possible. Like, to be honest, I didn't know, and I wasn't thinking of ever practicing in this country, but it's possible. If you decide to do something, just do it. Don't listen to anybody who tells you anything. So the most important thing is just if you're determined that you want to do something, you can do it. There's nothing impossible. Just reach out to people if you have any questioning doubts. You don't know how to do something, just ask for people. You're not the first one to go through that. A lot of people have been through that. They have a lot of experience and they can share with you, and then you can get everything done. So, and one thing, if you are applying this year, please just start working on your MSPE if you don't have it. Sometimes it takes time to prepare. Just have everything like your MSP done right now. That's all I can say.
Your personal statement, right?
Yes, and your personal statement, start working with that on time, because I had to do my personal statement, I don't know how many times. Reach out to people, hey, read this one. Is there anything that you need, think that I can change? Just don't do it. Don't do your personal statement at the last moment, because you might do a lot of mistakes there. Make sure everything is well written, there's no mistakes, and have people review your personal statement. Start reaching out to people that you know that you've worked with about letters of recommendation. Just not reach out to random people asking for letters of recommendation. Just start everything's planned right now. That's it.
Edward, are you there?
Yes, I'm here. Thank you again for this opportunity. Yeah, it's a long journey. It's a mental journey, psychological journey. But I want to emphasize how important it is to have self-belief, believe in yourself. You know, I don't like to use this metaphor, lakini sometimes it's important. Unapoenda kwenye vita, you know, it's like life or death. Unapoenda kwenye vita, you have to believe in yourself. Nobody's going to fight a war for you if you don't believe in yourself. So you have to have confidence in yourself, believe in yourself. Unashangaa, you hear in history 300 people wame overcome vita against thousands of people, right? They had to believe in themselves, and then when they saw that they are ready, believe in yourself, be excited, take this journey with enjoyment. It's not torture. Yani, believe, enjoy, take excitement. We are very excited for you. The future is bright. You are the future hope of Africa, of Tanzania, of the world. So believe in yourself. You're going to overcome the challenges. But the most important challenge to overcome is in yourself. The doubt in you. Somebody is going to. You have to believe. Umeona? Kabla mtu haja kupigania wewe vita.
Edward, you're breaking. Excellent. So I think the core message is believe in yourself. Frank, Professor Minja, are you on?
I say, unanega kitimoto, lakini siko sehemu nzuri. All I'll say is I'll echo all of the comments. I think it's very important, everything that has been said here. So I think you guys have pretty much shared the blueprint. So I think if people listen to like USMLE 101, 201, and 301, pretty much they should know what they need to do to move forward. And for those who have graduated and now even graduated from residence, just keep looking back and encourage those who are kind of coming through the steps. And even when you succeed in the US, don't forget nyumbani. So there's a lot of opportunity there. And I highly, highly encourage you to go full circle. There's a lot of opportunity to go there. Sometimes people say like, why are we doing this? We're contributing to the brain drain, blah, blah, blah. The bottom line is this. If you succeed and you're excellent anywhere, you're going to be an asset. And then you'll have the opportunity to really make a huge, huge difference. So don't sort of like, I really hope none of you are sort of like, I'm never going to do anything in Tanzania or Kenya or whatever. Those are your people. So, you know, that you also kind of go back and see how you can contribute in many ways. When you're in the United States and you're in a very good institution, you have a lot of ability to make a lot of influence on nyumbani. So just go full circle. It's like a big circle, yani. And that's all I'll say. Like basically, don't say, bueno, you know what? I'm gonna cut ties now. I'm making my US dollars. I'm gonna be in suburbia, middle of nowhere, USA, whatever. That's fine. That's fine. Like it won't be as fulfilling as if you go back full circle. So don't forget people are coming behind you. Don't forget nyumbani. And a lot of times that stuff will invigorate you as you move forward in your career. So you will find that it actually gives you a lot of satisfaction. So it's just a journey. I mean, this USMLE is one step. Residence is another step. Fellowship is another step. It's all part of life, and you meet amazing people. So keep the community together. And thank you, James, for pulling the group together and really streamlining this process. We have really tried to make it very open. For those who apply themselves, we are going to support them. Lakini kama unataka kunipigia simu and waste my time because you're still exploring whether or not you want to engage, please, this is not the group for you. And it's only fair. We've mentioned many times, many of you maybe only were able to succeed maybe because you connected with James and Frank or whatever, but we want everybody to have that opportunity. And so long as they apply themselves, we want them basically to succeed. And the more people succeed, the better off we're all going to be. So, so Achoyo, just share the stuff. It's going to be on YouTube. People reach out to you. But its key point is they have to apply themselves because, we only have 24 hours to kind of execute. So everybody has limited time, so we have to respect people's time. So over to you, James. Asante sana for coordinating, and asante to all the co-moderators for sharing your experience. Asante, over.
Thank you, everybody. I mean, it has been a pleasure. We are at the top of the hour, and I plan to end. As we said, we wish you good luck. Go on with your applications. We are here to help you. We are cheering for you. We look forward to you to come in the panel. We look forward for you to come to residence, to go into fellowship, and to transmit those skills. You know, Professor Minja now has started a fellowship in interventional radiology in Muimbili. He's teaching so many IR radiologists. It was unknown there. And it's what we are looking for. So Magacha, don't think, go for your GI. Want you to do endoscopic and go, you know, and help the people in Muimbili be able to, you know, to get those stones out. You know, don't get cholangitis and die. You get cholangitis, you get ERCP, they go in, they get it out, you live to die another day. So it's fulfilling, it's very rewarding to give, and position yourself that way, and the world will conspire for you to get what you want. You know, you won't lose anything by helping other people around you. So that's the key message. Good luck in your applications, and share widely, share kindly, help each other. God bless you, and all the best. Thank you so much.
Thank you.
Thank you.
Thank you.
Excellent. Thank you.